Hey everyone, and welcome back. You know what we find fascinating? Health insurance.
It's one of those things everyone needs, but no one really wants to think about.
Right, and it can feel like you need a degree just to understand the basics.
I totally agree.
So today we're diving deep into Forbes Advisor's latest article, Best Health Insurance Companies of 2024.
It just came out this October, so we're working with the freshest information.
Exactly. And look, we all want to find the best option, right? But as always, we're going beyond the rankings and looking at what the article really tells us about the current health insurance landscape.
Exactly. What does it all actually mean?
Like how Forbes Advisor actually kicks things off by reminding us what health insurance is even for. It's easy to get lost in the weeds with all the different plan options.
Right. You start comparing deductibles and coverage networks and completely forget what this is actually about.
Exactly. The article does a great job of bringing it back to the core idea. Health insurance is there to protect you from those potentially massive costs of medical care.
It's that safety net. You hope you don't need it, but when you do, you're incredibly grateful you have it.
Exactly. It covers those big expenses that most of us can't just pay out of pocket, like doctor's visits, treatments, medication.
All the things that can add up so quickly without some kind of coverage.
Right. And speaking of coverage, we can't talk health insurance without mentioning those different plan types.
Your HMOs, PPOs, EPOs, it can feel like alphabet soup sometimes.
Right. The article actually breaks down the key differences between those plans, especially when it comes to choosing doctors.
Which can be a huge factor for a lot of people.
Absolutely. And of course, they talk about what you can expect to pay out of pocket with each type of plan.
And they highlight how it's not just about those big picture plan types. You know, even within a specific metal tier, your bronze, silver, gold, and platinum plans, the details of the coverage can vary a lot.
Yeah, and those variations can make a huge difference.
Huge.
So Forbes gives us their top picks, 4 companies that really stand out this year.
But as always, it's important to remember it's not about declaring one winner, right?
Exactly. Everyone's situation is different.
Needs, budgets, what you're looking for in terms of coverage, it all factors in.
Right. It's about finding the best fit for you. So, who caught Forbes' eye this year? First up, we've got Kaiser Permanente snagging the best price badge.
They actually had the lowest average annual premium out of all the companies Forbes looked at, which is pretty significant.
And lower premiums are always nice.
Right. And even their average deductible for their silver plans was pretty reasonable compared to the others.
Okay, so what's the catch? There's always a catch.
Well, the biggest one is going to be their availability. They only operate in 8 states and Washington, D.C.
Ah, so limited geographic reach. That makes sense. Okay, next up is Aetna, highlighted for having the lowest complaint level.
Which, let's be honest, is a big deal when it comes to health insurance.
Nobody wants to be battling their insurance company on top of dealing with a health issue.
Exactly. And a low complaint level suggests that Aetna customers are generally pretty happy with their experience.
So things like processing claims smoothly, good customer service, those kinds of things.
All of that. Plus, since they're owned by CVS Health, members get some nice perks and discounts.
Oh yeah, the article mentioned that. Like, what kind of discounts are we talking about?
Well, there's a $25 quarterly allowance that members can use at CVS Health.
Okay, that's not bad.
Plus, a 20% discount on CVS Health brand products. So if you're someone who shops at CVS regularly, those savings could definitely add up.
For sure. All right, moving on, Oscar. The article highlighted them as a good fit for people who are comfortable with a bronze plan.
Yeah, within the bronze tier, their plans had some of the lowest deductibles.
So if you're relatively healthy, don't anticipate needing a ton of medical care.
It could be a more affordable option. You pay a lower premium each month. And if you do need care, the deductible isn't as daunting.
Okay, so lower premiums, lower deductibles. What's the trade-off with Oscar?
Again, it comes down to availability. They only offer ACA plans in 13 states.
Gotcha. So location matters again. All right, last but not least, we have Blue Cross Blue Shield taking the prize for Best Provider Network, which that's huge, right? Having a good network is so important.
Absolutely. And with Blue Cross Blue Shield, you've got options pretty much everywhere. Plans in all 50 states, and their provider network is massive.
It's got to be over 1 million providers. Right?
Try 1.7 million.
Wow. Okay, so you're definitely going to have choices with them.
Most likely, yes.
Yeah.
No matter where you live, you're probably going to find in-network doctors and hospitals.
That peace of mind probably comes at a cost, though.
You're right. The article did point out that they have the highest average ACA marketplace premiums out of the companies they analyzed.
Yeah, that makes sense. Broader access, more choices.
Yeah.
Usually means you're going to pay a bit more for it.
Exactly. It's always a trade-off.
That's so interesting, though, seeing how these companies are all trying to differentiate themselves. But I will say, I think this article gets really good when it moves past just the rankings and digs into the details.
I totally agree. That's where it gets really useful for people, right?
Totally. Because a best company overall doesn't mean much if it's not the best fit for your specific needs.
Exactly.
So let's get into some of those details. The article mentions that the average cost of an ACA plan is around $635 a month. Big asterisk next to that number, though.
Oh, yeah, huge asterisk. That $635 is for unsubsidized plans, meaning it doesn't factor in any potential financial assistance.
Which a lot of people qualify for and don't even realize it.
Exactly. Don't just assume you can't afford an ACA plan. Look into those subsidies. You might be surprised.
For sure. And even beyond subsidies, the article pointed out something I found really interesting. Age plays a huge role in what you actually end up paying.
Oh, absolutely. Like your age is one of the biggest factors when it comes to health insurance premiums.
Yeah, and the article actually breaks down those average monthly costs by age, which is really helpful to see.
It is. It gives you a more realistic idea of what to expect. For example, someone who is 27 years old is looking at around $446 per month on average for an ACA plan.
Okay.
But then fast forward a couple of decades, someone in their early 50s could be paying over $760.
Wow. That's a big jump.
It is, but it makes sense, right? As we age, unfortunately, our healthcare needs tend to increase.
Yeah. Makes sense. But hey, even with those costs potentially going up, it's good to remember what we're actually getting for our money, right? Those 10 essential health benefits that all ACA plans are required to cover.
Right. Those are essential for a reason. We're talking about mental health services, prescription drug coverage, preventive care.
Things we might not think about every day, but are crucial to have access to.
Exactly. And just as important as knowing what's covered is understanding what those essential health benefits often don't cover.
Right, because nobody wants any surprises when it comes to medical bills.
Exactly. So, for example, things like elective cosmetic surgery, out-of-network care, depending on the specific plan, certain types of experimental treatments.
Those are usually not going to be included in those 10 essential benefits.
Right. So it really highlights the importance of reading the fine print. I know, nobody likes reading the fine print.
But it's so important, especially with something like health insurance.
It can save you a lot of headaches down the road.
Absolutely. And speaking of helpful information, the article wraps up with a section called Expert Tips, and it's full of really useful advice for anyone navigating the world of health insurance.
It's such a good section. They talked to some real experts in the field, and they had some great insights. Like one thing they really emphasized was the importance of being an informed consumer.
Okay, so don't just jump at the first plan you see.
Exactly. One expert, Mark Fendrick, he cautions against just going for the lowest premium, which that's tempting. I get it.
Oh yeah, we all love a good deal.
Right. But he emphasizes looking at the bigger picture. So are your trusted doctors in network on that plan? What could your out-of-pocket costs look like if something unexpected happens?
Those are such good questions to ask. It's easy to just focus on that monthly premium without thinking about the what-ifs.
Right. And another tip that really stuck with me was call your doctor's office directly to confirm their network participation.
Because online directories.
They can be so outdated.
Yes. A million times yes.
So making that quick phone call, it's a small step that can save you a lot of hassle and potentially a lot of money in the long run.
For sure. And
Yeah.
for those of us lucky enough to have access to employer-sponsored plans.
Definitely explore those options because those plans are often the most affordable. Even if it's not offered through your own employer, maybe your spouse's employer or even a parent's employer if you're eligible.
Right. So many options to look into.
Exactly. Don't leave any stone unturned when it comes to finding affordable health insurance.
Love that. And here's a big one, especially for our listeners who rely on regular medication. Make sure, confirm your prescription coverage and any potential costs before you commit to a plan.
Huge. You don't want to be hit with a surprise bill for a medication you need to take regularly.
Exactly. And on that note, I think that's a wrap for our deep dive into the 2024 health insurance landscape. This Forbes Advisor article was packed with useful information.
It really was. But, as with all our deep dives, this is really just the starting point.
Right. Hopefully it sparked some ideas and gave everyone a good jumping off point for their own research.
Because at the end of the day, choosing the right health insurance plan is a personal decision. There's no one right answer for everyone.
Exactly. So much good advice in this article. But the biggest takeaway for me is be proactive. Knowledge is power.
Absolutely. And Don't hesitate to reach out to those insurance providers directly. Explore the resources that are available online and ask questions. The more informed you are, the better equipped you'll be to make a decision that's right for you.
Couldn't have said it better myself. That's a wrap on another deep dive, everyone. Until next time, stay curious, stay informed, and take care of yourselves.